Good evening. Hoping all are well. Today our very important session, long clinical case and communication. So first candidate choice is Dr. Mumtaz. Dr. Mumtaz, are you here?
Yeah, hello, I am here. Sorry, I was
Okay.
unmute.
Okay.
Good evening,
So
ma'am. Yeah.
okay. So first your case is long clinical consultation. I am giving you 2 minutes for preparation. The assessment will be held according to the real exam pattern. So all skill will be evaluated according to your performance. So I am starting our cases. Let's start. Your timer is on. Are you ready?
Just a little more. Yeah, I am ready.
Your timer is start. Let's start.
Yeah, hello, I'm Dr. Mumtaz, one of the doctor in medical admission unit. Are you Mrs. Jackson, 35-year-old?
Yes, doctor, I am.
So, Mrs. Jackson, today I will be talking with you and I will examine you. Is it okay for you?
Yes, doctor is okay.
So, Mrs. Jackson, can I ask what brought you here today?
Doctor, I have a severe abdominal pain and it's not tolerating at all.
I am sorry to know. I will offer some pain relief. Is it okay? We can talk.
Yes, doctor, thank you so much.
Thank you. So can you tell me when it started?
It started, doctor, 3 months, but nowadays I cannot tolerate at all.
And is it started suddenly or gradually?
Gradually, doctor,
Mm. Is it present all through the day or it comes and goes?
it comes and goes.
If I ask to grade the tumor where 0 is no pain and 10 is maximum pain, can you tell me how much grade of tumor, grade of pain?
You can tell nowadays it is around 6, but previously it was 4 to 5.
So it is increasing also in severity.
Yes, doctor.
Okay, can you tell what is character of pain? It feels sharp, dull, stabbing,
Stabbing, doctor.
stabbing. Do it go anywhere, like in back or any other place?
Yes, doctor, you are right. It goes to my back.
Do you have any other complaint like throw up?
Yes, occasionally I have been feeling sick, not throwing up.
Mhm. Did you ever throw up any blood?
No, doctor.
Any dark color stool?
No, doctor.
Any fresh blood in the stool?
I didn't notice.
Mhm. Can you did you notice anything making it more just like taking food uh, or certain items make it worse?
Previously, I was taking
Mm-hmm.
some painkiller, but it was not improving nowadays. Previously, I feel little bit good.
So you were feeling better with some pain relieving medication before, but now
Previously,
nothing is
yes.
working.
Yes, you are right,
It is
doctor.
it is present all the through the day now,
On and off, yes.
on and off. Okay. Did you notice anything making it worse?
Like,
Making after taking food?
I didn't notice, doctor.
You don't need. Okay. Do you also feel some raised temperature?
No, doctor.
No. Any excessive sweating?
No, doctor.
Mhm. Uh, uh, so you did not feel any time, you just feel sickness, but no throw up.
No, doctor.
Did you feel difficulty swallowing?
No, doctor.
Any mouth ulcers?
No, doctor.
Did you feel any acid brush?
No, doctor.
Any yellowness of skin or eyes?
I didn't notice.
Mhm. Uh, any itchy sensation?
No, doctor.
How about your weight? Is it do you have any weight changes?
Not so much, but I feel very weak.
You feel weak. So you did not lose any weight or you did not gain any weight
No,
recently.
doctor.
And how is your appetite?
It's a fine.
Fine. Okay. Do you have any racing pacing of heart?
No, doctor.
Any difficulty in breathing?
No, doctor.
Any weakness localized anywhere?
I didn't notice.
Any joint pain?
I have muscle pain. I always feel my all muscle are painful. I always feel the all over my body are pain. I don't know why.
Do you also feel tired?
Yes, I say that I always feel weak.
I am sorry to know that. I will try to help you. Mm.
Thank you, doctor.
Then can I ask, do you have any past medical condition
Like,
like high blood pressure or high sugar?
no, doctor, but my last checking blood sugar was HB1C, and for that reason, my GP given anti-diabetic drug.
You are taking these medications.
I started around 3 months, doctor.
Are you compliant taking it regularly?
I tried my best.
And what is your last HbA1c?
8.
It and when it was
Last
last month?
month.
Last month. Okay. Do you have any other medical condition other than diabetes?
No, doctor.
Do you take what medication you are taking? Can you show me the drug list?
Patient showing liraglutide.
Liraglutide. Okay. Uh, do you take any over-the-counter medication?
As I said, for the pain relief, I am taking tramadol.
Tramadol. Uh, any other herbal medication?
No, doctor.
Do you have any allergy with any medication?
No, doctor.
Mhm. How frequently you are taking tramadol?
Now it is on and off always because I have severe pain. I cannot tolerate. That's why I visited now.
I'm sorry to. Do you have any disease running in your family?
My father has a stroke. My mother has ulcerative colitis.
Mhm. Father has a stroke. I'm sorry, but at what age it happened?
Age of 65.
Mhm. Okay. Do you smoke?
Yes, I do.
How many cigarettes every day? For how long?
I'm taking cigarettes around 10 years and 15 seconds per day.
Smoking in any number is harmful for our health. I will advise you to stop smoking, and I can refer to smoking cessation clinic. Is it okay for you?
I'll think about it, doctor.
Okay, thank you. Do you drink alcohol?
On and off.
And how many units in a week?
Occasionally 14 and 15.
Unit. I will ask you to moderate it little lower. Do you also binge anytime in a weekend?
Not likely.
Okay. What do you do for living?
I'm a cash accounter.
And how this condition is affecting you?
I cannot do any job because I have severe pain.
I'm sorry, I will involve my social worker and they can help you. Do you drive?
Thank you. Yes, doctor, I do.
I will ask you to stop driving and inform DVLA until your condition is resolved. Is it okay?
Thank you, doctor.
Are you in long-term relationship?
I have a boyfriend.
Mm. So, do you have any casual relation?
No, doctor.
Mm. Did you travel anywhere
I
recently?
was in last month's pain.
Last month. Did where did you stay? And did you also eat some street food like that?
Yes, doctor, I did.
Mm. Can I ask, do you have any loose motions?
Occasionally, I face some hard stool, not loose.
Hard stool. Do you have any weather preferences?
No, doctor.
I have to ask some personal question. I must ask with everyone. Can you tell me how is your periods?
It's regular.
Any extra regular and no extra flow?
No,
Do you
doctor.
take any pills?
Yes, I do.
No. Do you have any problem of plot problem in your family or with you?
No, only my father has stroke.
Any mm, miscarriages in past?
No, doctor. 2 minutes left.
I examine you. Yeah.
Sure.
Sure, I will examine the pulse. Pulse is as given outside. Blood pressure is
Yes.
little higher.
Blood pressure
And
is
then,
155/90.
yeah. Then I will check pallor icterus oral cavity.
There is no palo, no icterus.
Then I will come to per abdominal examination. I will check for any tenderness.
There is a tenderness all over the tummy and patient telling, sir, be gentle for me.
Yeah, I will be very gentle. So I will check for tenderness, and there is no organomegaly. So,
You are trying to palpate through your superficially. There is a no palpable mass, no organomegaly, no splenomegaly.
any rigidity.
No, there is no rigidity
So,
noticed.
Mrs. What is your concern?
Doctor, why I feel some numbing feeling on my hand? Is it like a stroke?
Numbing feeling in hand. Uh, uh, so, Mrs. Jackson, what I discussed this with you, and um, on what I found on examination, I think your condition is due to pancreatitis, which can be due to medication given for your diabetes control. In this, due to this soreness of pancreas, the calcium level comes down, and it can be a reason for numbness. Are you
Why
with me?
my urine color are sudden dark nowadays?
So it can be due to mm, same soreness of pancreas. It can cause a severe soreness reaction inside our body, and it yeah, blood can be dark.
Could you show my one of the skin rash which
Oh,
appeared
no.
last 2 months, doctor? What is that?
Mhm. Yeah, it can be a rash, and it can be due to some hereditary condition, due to lack of some enzyme in your body, uh, due to which some chemicals accumulate in your skin, and it can give you rashes, which is more after exposure to skin. And your tummy pain can also be due to this lack of enzyme.
Thank you, doctor. Your time is up. 30 seconds for your recap.
Mhm.
So, doctor, could you tell me positive finding in your case?
So, Mrs. Jackson, 35-year-old female, presented with severe pain abdomen, which is all over the tummy. Um, she is a known case of diabetes on liraglutide, and she is always taking some painkillers for relief of pain, but it is not responding with pain medication. On examination, I found there are some skin rashes over of skin rashes over forearm, and on examination of abdomen, and found that abdomen is tender, but there is no organomegaly, no rigidity. So, based on clinical examination finding, it is a case of acute intermittent porphyria. Yeah, giving pain abdomen.
What else in your DD?
Uh, it can be pancreatitis, drug induced. It can be tramadol induced gastritis.
Mhm. Anything else you have on your DD?
It can be porphyria cutanea tarda.
So, doctor, could you tell me what are the investigation plans you want to do for this case?
Apart from general general lab like CBC, ESR, CRP, urine dip, electrolyte, and urea creatinine. I will be doing an ALA level. Mm, and yeah, we will also do imaging of abdomen.
Which specific enzyme you want to do here?
What is this ALA? Am I ALA
For
hydroxylase?
confirm your diagnosis, is there any test do you have to determine your case?
ALA deficiency, hydroxylase deficiency.
So how you want to manage your case?
We will admit the patient. We will start IV fluid, dextrose-rich IV fluid. We can give him hematine, dextrose-rich and hematine.
Do you want to do any specific management in your case apart from this?
Yeah, we will first of all, our management will include non-pharmacological and pharmacological. In non-pharmacological, we will give him a diet education counseling, and we will refer him to dietitian. And pharmacological treatment, we will be giving him for acute attacks. We will admit him. We will start IV fluid with dextrose-rich fluid and hematine.
Any advice you want to give in your case?
We can give for genetic counseling for
Your
kids.
time is up. Thank you, doctor, for your participation. Now your feedback. So your overall performance was good, but your liraglutide was on your DD. Okay. Whenever acute abdominal pain scenario came in exam, so DD is very vital. So on the DD, as I said, there is a pancreatitis issue of the liraglutide induced. Apart from that, other DD must to evaluate it. In UK, even one case they given ectopic pregnancy, female. Okay. As a
Yeah.
female, you already told regarding the menstrual cycle, but last month, how long it is important to keep your differential. Be safe, doctor. What is that? First, yes, it could be acute intermittent porphyria. Second, acute pancreatitis, drug-induced. Evaluation, very important. The evaluation finding any kind of the stress, patient is smoker, any kind of the fasting, any physical stress, emotional stress, alcohol, or oral contraceptive pill, or are the triggering factor for having intermittent porphyria.
Yeah.
Second is
OCT
that,
is a stop.
yes. So you have to tell, always very vital in real exam to remember what I am telling, they are writing. Always remember that I am telling even one single word, they will write on their notes. So first I ask the DD, always keep all acute condition DD, though it is started 3 months, it was gradual, now sudden onset for the 3 days. So gradual and now acute. So according to the DD, you can keep, as I said, acute intermittent porphyria. Second, you can tell acute pancreatitis. Third, acute cholecystitis. Fourth, you can tell hereditary angioedema. Why? It is one of the DD. You can ask shortness of breath, any allergen sensitivity. It is just for excluding method. You are showing I am excluding renal colic, any kind of the pain nature, stabbing, sharp in nature, or rolling. Patient is rolling. It's a renal colic pain.
Renal colic.
Ectopic pregnancy. Yeah, colic pain. So nature is a vital. So very important to structure wise DD. Your DD was nice, but DK you can keep ectopic pregnancy, though you excluded, it's fine for them, but DD marking is very vital. Second, for your judgment, clinical judgment. For the clinical judgment, porphyrin level and gene testing, you didn't utter. So they will cut down your mark. for the satisfactory. It will be borderline. Okay, porphyrin level. And I will do the genetic test to confirm. I asked which test you want to do for confirmation. Blood, urine, or stool test to measure porphyrin level. And genetic test
Yes.
as well. Yes, CBC, yes, all the tests fine. For my, as it is my top acute intermittent porphyria. So first I have to confirm my, because is asked by examiner which test you want to do for your confirmation. It is the porphyrin level. Second is that there is a number that you have to keep on your pocket. Be safe. Second is that advice. Yes, multidisciplinary approach. Okay. Multidisciplinary. Kindly mute, doctor. Kindly mute. According to the multidisciplinary approach, what investigation I will do apart from the basic investigation, for more specific investigation to rule out my investigation one by one, step by step. For my confirmation, urine or blood, stool, porphyrin level, I can do genetic test. For other evaluation, cholecystitis, ectopic pregnancy, pancreatitis, CT, MRI, fine. Amylase level, CBC, so you can tell one by one. I want to exclude these tests. Second is that to stop smoking, to stop the alcohol, stopping the OCP, liraglutide all together, because you are presenting your case on the examiner, they will give in the mark. So it is you have to ensure that I am telling and they are giving the mark. So is it borderline or unsatisfactory? It is you have to ensure what I am telling. Third is that here, Dr. Mumtaz, in examination scale, I'm giving you borderline and one unsatisfactory because you missed the question. I showed lastly the rash. So according to you, DD, do you have any skin rash? Joint pain, I didn't tell. I said all over the body, I have a muscle pain. So
Muscle
very
pain, yeah.
important. Muscle
Rash.
pain, rash, my urine discoloration on the sun exposure. I told myself by lately, but in Hyderabad, in the many centers, they never tell even single word, never tell. So very important to utter yourself. Do you have any kind of skin color discoloration of the urine, any color discoloration of your skin, any rash do you have on your sun exposure? You have to ask and evaluate all the point. Clear? So I'm cutting down your mark on the physical examination. Clinical communication, as you didn't ask, relevant 2 to 3 points regarding the rash, tingling sensation, even stress, very important. It is one of the predisposing factor for having triggering factor. So it's also important. So I'm giving satisfactory or around 3, physical examination around 2, and clinical judgment I'm giving only 2, and managing patient concern I'm giving you also 3. Because though you keep it is acute pancreatitis fine, but acute intermittent porphyria was topmost. So it is only 2. Differential diagnosis of 4 out of 4. Your differentials accepted according to the examiner, and patient welfare also 4. So your score around 24. Clear, Dr. Mumtaz? Any question you have?
Yeah, clear.
Any question, any concern, anything you have to ask or modify, or you can ask me.
No, it is clear.
Thank you. So I'll discuss furthermore regarding this case later after the communication. Thank you. My communication case, the candidate asked me personally, the candidate name is Manoj Shondhi. Yes, I'll take all the question after the communication. Dr. Manoj Shondhi is here. If he is not here, Dr. Manoj Shondhi, another doctor name was on list. Can anyone raise who knocked me personally for doing the case? Bilal Bashir, yeah. You told me that you have exam also. So Dr. Bilal Bashir, unmute your mic. I'm giving you communication scenario. Recent dietary cases. So Dr.
Yes.
Bilal Bashir, yes, just I'm giving you your timer. Dr. Bilal Bashir, I'm giving you 2 minutes for your preparation. Are you ready?
Yes, madam.
Let's start.
Good evening.
Good evening, doctor.
My name is Dr. Bilal, and I'm one of the PACES candidate here. And am I talking to Miss Roma, 45-year-old?
Yes, doctor, I am. My
And
mom
you,
is Miss Anne.
okay. Today we are here to discuss about your mother condition. So before we discuss, can you tell me what do you know of her condition right now?
Yes, doctor, my mom was admitted 3 days ago due to cough, and there was so high temperature. And you, doctor, told me that my mom developed pneumonia, infection of the chest. And you,
Mhm.
doctor, also told me that my mom is on the antibiotic, but I'm so concerned for few things like my mom has some memory issue as well. My
Mhm.
mom has the skin problem, so that I was concerned along with my mom. So I told regarding your consultant for the further evaluation. So I'm waiting for is there any decision taken for this dementia skin lesion, and what are the appropriate measures taken by your consultant?
Mhm. Uh, well, Miss Roma, I'm very sorry to hear about your mother condition. Uh, your mother was having the memory problem and was already diagnosed as a case of dementia. Did you know about her previous diagnosis of dementia?
We know that regarding the memory issue, but the dementia, as you said right now, it understandable.
Okay. Secondly, she was admitted with the treatment. You already know that she was admitted with the for the treatment of pneumonia, and her pneumonia is improving day by day. Are you
Thank you,
getting me?
doctor. Yes, thank you, doctor, for your nice words that my mom is improving.
Thirdly, there is an important thing I want to discuss about the skin rash she is having at the moment.
Okay,
Uh, well, I'm sorry to tell you that I have some bad news for you.
bad news. Just now you told me my mom is improving. It's okay for nice for me, but what is the bad news?
Actually, the skin rash she is having is a type of cancer. I'm very sorry to tell.
Cancer? What you are talking about, doctor? How it possible? My mom is fully okay. Are you talking regarding my mom or anything or anyone else? I mean, what you're talking right now?
I'm very sorry to hear about. I'm very sorry to tell you, and I can understand that this word is very stressful for you. And but the skin rash she was having is a type of cancer which was diagnosed by appropriate testing, and this cancer is called malignant melanoma in our medical terms.
Oh my
Have you?
God. Is it serious?
Uh, yes, it is a type of cancer which is, if it timely excised, so it's not and is completely excised, and so the patient get rid of it. But if this cancer spread to other part of the body, unfortunately sometime it become very difficult to control it. And
Why it happened, doctor? What's the cause behind it?
yes, you have asked a very good question. There are some risk factors like excessive sun exposure over a longer period of time may cause such kind of skin cancer, and there are some
Sun
other causes.
exposure. But I listen by others that some smoking is a risk factor for having cancer. But my mom is not a smoker, doctor. Why it happened?
Well, smoking is also a risk factor for cancer, but smoking do not cause all kind of cancer. Smoking, there are some cancer which is associated by smoking, but this skin cancer is not due to the smoking, but it is due to the excessive sun exposure. Are you getting me?
Okay, very hard time I'm passing right now. It's a very terrible time, really. What you do for my mom right now?
Well, I can understand that this moment is very stressful for you, but don't worry, we are here to help you, and our team of doctor already examined your mom, and they decided that this cancer should be excised, should be removed from the body as soon as possible. Are you getting me?
Doctor, apart from this surgery, is there any medication you can give to my mom? Because my mom is very sensitive. My mom cannot tolerate it, doctor. Could you do it any kind of the medication?
uh, because this cancer is very resistant type of cancer, and we do not have any appropriate medication to give to your mom which can cure this type of cancer. The best treatment for your mother is to remove this cancer as soon as possible. uh, uh, if This is the best type of treatment for your mother.
But as she very afraid regarding the surgery, is there any alternative, doctor?
Well, what alternative we can for the treatment of cancer? The best treatment for your mother, as I already explained, is the surgery. We have already the patient is already old and having the pneumonia and other. The team of doctor is also doing some tests to see the suitability of surgery. We will do all the and we will all the necessary precaution and testing to see whether the cancer has spread to other part of the body or not. We will involve the cancer specialist doctor and the skin doctor and other doctor. They will they these team of doctor will do what is in the best interest of the patient, and all these doctor have decided that there is the best treatment option at the moment for your mother is to remove the cancer surgically. Are you getting me?
Yes, doctor, I'm with you. 2 minutes left.
So do you have any other concerns or questions regarding your
Yes,
mother?
doctor. I'm requesting you kindly don't tell my mom. She'll be very upset, doctor.
Because your mom has already a memory problem, so we cannot hide any. If your mom has the capacity and your mom has understanding, we cannot hide it from your mom. It's our moral duty to take the consent from the patient if the patient has the ability to give the consent. And if the patient is not able because of memory problem, if the patient is not able to understand and give us the consent, then we will look for any lasting power of attorney or any advance directive. And if we do not find any kind of document, then our team of consultant will be the in charge of the patient and will do what is in the best interest of the patient. So
Okay,
are
doctor.
you,
Thank you.
are you getting me?
Yes, doctor, I understand.
So our team of doctor is already treating her pneumonia, and similarly we will plan our further decision accordingly, and we will keep in touch with you, and we will uh, uh, if any consent or anything happen, we will inform you accordingly.
Thank you. Your time is up. Thank you, doctor.
Thank you so much.
Thank you, Dr. Bashir. Your case was very well, but regarding few feedback as I'm giving. So before feedback, I want to start nowadays the scenario coming like malignant melanoma regarding the disease, multiple sclerosis, thyroid. Always remember these steps. Okay, very important because your structure will guide you how to carry full mark. First, still, do you have any idea regarding the malignant melanoma? It is a type of a skin cancer that can spread other areas of the body. The main reason could be ultraviolet light, regarding the sunlight. As I raised the concern, my mom is not smoker. Why it happened? It is absolutely valid concern that you raise. Sometimes smoking is not only one responsible factor. The age, sometimes color, changes, skin, very important. That might cause this kind of the cancer. Another very important, the causes. As you said, next is that what might possible symptoms. Okay, to utter those symptoms. Okay, very important. Which area might possible for having? Because this kind of the communication now it is ongoing. Very important step by step. This is the skin lesion which may spread eye, soles, palms, and private part. But you have to look or you have to advise your mom any kind of the skin changes, bleeding, itching, any kind of the sign. If your mother notice, must inform us to take further action. The symptoms is very important. Any kind of swelling, redness, crusty, these are the signs we have to take seriously. Sometimes we have to take the specialist for the more care, though they already told the specialist care taken by surgery. But as I said, why step by step? This might possible of the symptom you are uttering that even after discharge as your mom of the pneumonia that if she might face any kind of the difficulty, don't delay for inform us. So these are the very important when to visit, sometime urgent assessment, urgent evaluation, urgent referral. Because question asked by surrogate, when the mean by urgent, how long it will take time if it is urgent. So within 2 weeks mean it's urgent referral. So pale of the skin, redness, blue, these are the changes very important to utter those words. So as here confirmation via already malignant melanoma, but some scenario could be changes, doctors. Like still we are not sure about it. So you have to utter that excisional biopsy you have to do for confirmation, dermatology specialist. This scenario I put according to the exam, but in exam in many center in this scenario they'll change few lines, still not sure, possibility, need biopsy, may need surgery. So each point you have to utter one by one. So excisional biopsy most main definitive test for confirmation of the diagnosis and for the treatment purpose as Dr. Bashina said, yes, surgery. But if it is advanced, though it already told that surgery, but even sometimes need any chemo and radiotherapy if any kind of this advanced stage. So these all the words, any kind of staging we have to do. Sometimes we have to utter the sentence that this malignant melanoma it can spread other part of the body, but most appropriate treatment is a surgical excision. So question may arise of surrogate concern. So if other part of the body same lesion appear, what you will do? Same treatment is the surgical resection. If we evaluated through the biopsy advanced stage, then chemo or radiotherapy according to our cancer department or oncology. So as right now ongoing combination, no examiner crossing, no examiner question. So you have to be very strongly, you have to tell all the point, each communication based doctors. Okay. So the concern Dr. Bashir, nicely meet how you manage, why it happened. It's the my mom is very sensitive, can't tolerate. So nicely they can say yes, it's understandable. She's very older, but no need to be worried. We have a group of doctors. They'll take care regarding that discomfort, but it's very important. We decided for doing the surgery. Surgery is very vital for removing these kinds of the cancers, because if it is advanced, we cannot do it, can spread. So reassurance and description very important. So these are the case of the malignant melanoma. For the Dr. Bashir, performance overall is okay. Clinical combination is satisfactory, and regarding the managing patient concern, also the satisfactory, and regarding the clinical judgment, also satisfactory, and patient welfare. So overall, full mark. Okay, Dr. Bashir, any question, any concern you have?
Thank you. Thank you.
Thank you, Dr. Bashir. But my one advice before exam: be fluent, be structured, try to fluently talk what you are talking, and made a structure before entering in the room. Made a structure. This is my scenario. These are the steps I should tell, and I never would do miss any point, because they'll cut the clinical judgment. I hope you understand. So any concern or any question regarding the previous cases, ongoing cases from long clinical case, and communication from anyone?
Hello, doctor.
From yes, doctor.
Doctor,
Andy?
I want to ask you, in history
Yes.
taking, why
Yes.
they have to hide the information? Like, if you ask the patient, do you have any urine problem? He should tell that yes, my urine color. Why I have to ask everything? Why they should
Yeah.
hide the information?
Actually,
Because it's not happening in the real life.
yes, you're right. Actually, why we are practicing doctors? Okay. This feedback mean more than 100 of doctors told. I asked what about urine. They didn't tell me frothy. They didn't tell me the changes. So why we are practicing every day? Why? Because if I miss any point, I'll miss my diagnosis. So another very important is that step by step, you cannot ask two questions together. So some surrogate issue, doctor, some surrogate issue, they instructed by them. If they ask, then you will tell. Neither, no need to tell. So this means your surrogate issue. Many center in the India, in Oman, they never tell even single word. Okay, if you don't ask, but sometimes even surrogate are talking, yes, I have this one, no, nice surrogate. So practice to confirm my strength, my strong point, that I didn't miss any point. So sometimes it is luck that even you ask simple, do you have any urine changes? Say yes, I have dark color, I have burning. It's a fine. But if they don't tell what you do, you missed your diagnosis, doctor. So based on practice, whatever group practice with friend practice, best to ask those group of question. What are the group of question? What about your urine? Any color changes? Any burning sensation? Any pain over there? You are on the safe side. No
So,
question
doctor,
missed.
you mean for
Yeah.
each system, you should ask all the questions related to the system? Because
Step
what I
by
was
step.
doing,
Yeah, step by step. Yeah, one by one. Because if they ask, if they told you, you look nicely, they are telling, it's so nice. But if they don't tell what you do, you are missing your diagnosis.
mm,
Mean lots of mark will be cut down. You understand what is the trouble?
yes, doctor.
So better to do a structure-wise approach. Abdominal pain intensity characteristic, where it goes, where it downs, is any relieving factor, any fasting, any kind of the food, or any relieving factor, any contributing factor, any kind of aggravating factor. You said I'm asking pain. Why they didn't tell if any kind of the food like mesenteric ischemia? If I take food, I have so severe pain. Why my patient didn't tell? Because patient instructed by this way. They never tell you any single even sentence. You understand, doctor? So very important, be safe side and ask group of question. Each symptom based, even cough, even dizziness. Before, during, after, all the question you have to tell step by step. Clear, doctor?
Okay, doctor, thank you very much.
You're welcome. Any question from Anis 1?
I have a question about the communication. So in this patient, we should discuss the lasting power of attorney, advanced directive, and living will.
No, here, why not advanced way to living will? They didn't tell you it's advanced cancer spreaded. Then we can, very important this question uttered by Dr. Elfadil. Very important, many candidates did it wrong. No, it is a disease counseling scenario. Remember, disease counseling means multiple sclerosis, pheochromocytoma, only disease counseling management. Though they twisted here by advanced dementia, but they didn't tell you the advanced cancer. No, dementia is another issue. Cancer is it malignant? Is it aggressive one at staging? No. Only management, they already told you that surgical excision is the most appropriate management. So don't utter LPA, advanced directive, because no need here. Surgical excision means it's on good stage. You understand? So you have to utter those because no need to raise by yourself because they will cut down your clinical judgment, doctor. Okay. So very important to understand the scenario. But if you raise this issue by yourself, no need, they'll cut down your clinical judgment. Okay, no need here. Clear?
Okay.
Any question by anyone?
Hello, madam.
Yeah. Hello.
Yes.
Hello. Assalamu alaikum, madam. How are you?
What? Yeah, I am fine, doctor.
Okay. Thank you very much. Both cases were very interesting and very useful. Can you please display the picture of first case again? I want to take snapshot.
Sure, doctor.
Okay. Thank you very
You
much.
mean, yes, thank you.
Doctor, one more question. Like
Sure.
now what I understood that you should not give only one diagnosis. You should be always ready with
Always,
so many
always.
differential and say
Yes.
again if this that patient doesn't have this.
Yes, you are right.
Okay.
Doctors, remember, very important. I always telling my personal candidate who are taking the course, like there is no skill on the passage reach the diagnosis. No skill. We are doormen. We have a list of differential. We should confirm via test and will manage accordingly. Don't tell only pancreatitis, only gastritis. No, I have DD on my hand. It could be pancreatitis, it could be gastritis, even it could be ectopic, though I'm not sure because I didn't do beta-HCG. It is a female patient. When what was last, it could be missed pregnancy, obviously. We are not sure. So don't
And
tell specific diagnosis. Yes, doctor.
and is it
Tell
the
me.
same, doctor, when we are answering the patient concern about what he is having, should we say a list of differential or we'll just say the
No,
most
yeah,
likely
most
diagnosis?
possible. No, better be safe. Even if you cannot reach, always be safe. I have a list of possibility in our mind or in my mind according to scenario and examination. But I have to do some test for confirm my diagnosis, and according to our group of doctor, will reach you after getting the result. If you confused according to your diagnosis or DD, tell safe way because you have to carry mark. No need to mark cut down on the judgment or DD. No, tell DD. I have possibility because the concern there is a mark. So tell I have a possibility. I have to confirm through my diagnosis. Most possibility for having like this one, but not sure still now because I'll run some tests and confirm you later. Clear, doctor?
Okay. Okay,
Thank
doctor.
you.
Thank you very much.
Yeah. You're most welcome.
Just to be sure, here in this scenario, no need for last power of attorney or advanced directive. Yes.
No, doctor. Advanced dementia, don't miss this point. Advanced dementia is not advanced cancer because this question, this scenario missed by this one. Advanced dementia is not advanced cancer. No need to raise this issue by yourself. Okay, no need to raise. This is the disease counseling scenario. That's why I put this one because many candidates given no advanced dementia, advanced directive lasting power attorney. Only simple diagnosis, investigation, management, further steps, what we will do, and advice. That's it.
Ma'am, when the
What
daughter
about
said
consent?
to
Of course, there is no
hide
consent.
from her mother, so how will we meet this concern?
Yeah, Dr. Bashir said, and I
No
said that
consent.
as your mother, yes, I'm telling the kindly mute, I'm telling one by one, okay? As I said, and Dr. Bashir said, as your mother has full mental capacity, though she has dementia, but she has mentally capacitant acceptance. We cannot hide. It is a rule. We cannot do. It's against the capacity or against the rules of this to convey the message. Though surrogate or the daughter telling my mom is very sensitive, kindly hide, it's not possible, though your mother is fully mentally capacitant, doctor. Clear? We cannot hide any kind of the disease investigation finding if anyone have fully mentally capacitant.
Madam, dementia patient, how she will have mental capacity?
Mental capacity, you have to, if you are confused this line, advanced dementia, it's a dementia. And capacity mean I'm telling you, doctor, I have this a problem. It's a, you are understanding my problem. It's a capacity. But dementia mean
No.
I'm forgetting. It doesn't mean that I don't have any sympathy, empathy, I don't have any reaction. You have to
No,
understand that, yeah, tell me, Dr. Bashir.
in the capacity, we will have to present the information. She has to understand, she has to retain, and she has to tell us back. So
Yes.
dementia patient will not be able to do with this, I think.
No, doctor, not till like I think. Always try to understand mental capacity mean what, dementia mean what. Dementia, vascular dementia, Alzheimer disease, mentally capacity. If I say, doctor, a patient on ICU have delirium, is she mentally capacitant? Yes or no? No. She is not mentally capacitant. If I say this is a patient of schizophrenia, hallucination, is she mentally capacitant? So mental capacity assessment is very vital. If you concern that yes, your concern is so valid, so we have to assess furthermore. If you how to answer this concern, mean you are in real exam but you are not sure how to answer this concern. So tell, okay, fine, your concern is very valid, but I'll further assess environmental capacitant. If she fully mentally capacitant, we'll have to give this feedback regarding the malignant melanoma. You understand? If you're confused whether I'll do or whether I'll tell or not, so mental capacity is the issue, tell this indirect way, not directly, tell indirect way, we have to do further assessment, but actually we have to convey this message to the patient. There is no mental capacity issue. Clear?
Okay, doctor, but in the beginning, he didn't mention that the consent of the, if she is like you're saying that she's demented, but she has capacity. Like they should make sure that the mother are aware of their meeting. What do you call it, confidentiality or consent or something?
Yes. As she and the mother is fully mental dementia and concern is a, if you are confused, tell we have to convey another assessment of the mental capacity, then we'll have to convey this message. It is very vital to understand the issue because the patient who's have this disease, obviously they have to monitor according to the seriousness and they'll convey the message, I have this bleeding, right? So without, if she cannot understand the assessment, the disease, how they'll convey the message. So better if she is fully mentally capacitant, we have to demonstrate the disease, what actually happened to your mother. Clear or not? Anyone? Any question, any confusion regarding the dementia?
The management of the melanoma?
Yes, obviously. First, yes, obviously. First of all, remember for the melanoma assessment management, further assessment need like any redness, swelling, any kind of the lymphadenopathy, mean any advanced stages. Initially, if it is not advanced, simple crusting, okay, simple redness, we can do simple surgical excision. That's it. It's improving. No further damage. But if it is not, like it is spreaded, it can spread lungs, kidney, even brain metastasis. It could be, even if this is the advanced stage, doctors remember, we have to do only chemo and radiotherapy to decrease the surgical decompression or to reduce the cancer severity. Only chemo or radiotherapy. This decision will be taken by our oncologist or cancer department. Clear?
Doctor, in this case, should we discuss about the consent, the like pre-operative, the possible complication?
First of all, if pre-operative treatment, and still now the mother don't know. First, your duty to convey the message, right? And to convey the management. If surgical problem, as I said, don't tell my mom. Why? Because my mom is very sensitive. Even though what is here, that this case two. One is diagnosis, second is management plan. Two issue I have to raise. So if they say, oh doctor, you have surgical management, kindly don't tell. Without telling how I take the consent. This is another surrogate issue, okay, or concern. So if the concern raised, don't tell or no need to take any consent, no. First, I have to convey the text or message. Then we have to convey this management plan. Then we have to take the consent. If she is mentally not capacitated, then we'll take from the second authority or second one who can take the consent from the behalf of your mother. It is not now issue. If this concern raised by surrogate, clear or not?
So, doctor, we can say that your mom might need assessment for her mental capacity,
Yes.
and based on
You
this, we
can
will
raise,
decide.
yeah, no, if they say that, kindly don't tell. Why? If I say, no, my mother has memory problem, it's a memory problem. But if you're sure memory problem is not a mental capacity problem, mental capacity means you are not understanding your status. It is capacity. You are not understanding, it's a severity, it is a capacity. But dementia, I mean, I'm forgetting. It's okay, fine. I can forget now and this. It doesn't mean, but if you're not sure, you can say, okay, we can do assessment for further confirmation, and then we'll convey the message. That's it. Be sure, be smart, or be always safe.
Madam,
Clear?
can you share the case again? As it is some different cases showing on the screen.
Which one, doctor?
The
Okay, this one
What
by
we are
one
discussing.
doctor. Okay, I'm showing. Yeah, this one.
the-
Communication.
Yes,
Yeah.
ma'am.
No problem.
Doctor, should we discuss in the management plan that will tell the surrogate that we would like to do further testing like staging, or no need to mention that? Because it's not
Already it
mentioned in
is
the scenario.
confirmed, you know. Already it
Yeah, it is
confirmed
confirmed,
this
but
malignant. Yeah,
but
that's no need. Actually, we do biopsy if they
no,
don't confirm you on the test. Remember, on communication, doctors kindly read 3 to 4 times in real exam. Each point is a vital. Even if you forget, kindly when you enter the room, try to read. If you miss, don't tell by yourself. Don't utter any word which not written. Don't make yourself. If they already told it's a malignant melanoma, it's a colors, means a confirmed, okay? Confirm it is. So no need biopsy.
I mean staging, like staging. You do CT, PET scan, so
Staging mean already management confirmed via surgical resection, mean they did it. It's indirectly. Already they told you that they did it, and it's a management surgical excision. So no need to do it right now. Clear?
okay, I understand.
So thank you so much, doctors. Hope you all enjoyed our session. Thank you so
Thank
much.
you.
I'm ending my session. Thank you so much. Thank you.
Thank you, doctor.